What is a functional rhinoplasty? Well, functional rhinoplasty is unlike a cosmetic rhinoplasty, is concentrating more on the function. We're always trying to balance patients' breathing together with cosmetic change. But in a functional rhinoplasty, the focus is very much on trying to get the breathing better, and we use various techniques which can be used in combination with cosmetic techniques as well. As part of a functional rhinoplasty type procedure, what sort of things can we do? Well, we can straighten the nasal septum, which is the obvious thing that people get problems with. And that's the bit of cartilage and bone in the middle of the nose. We straighten that out and that improves the breathing. But sometimes we need to add grafts as well, including so-called spreader grafts and other grafts around the side of the nose to help stabilize the airway and particularly the nasal valve region, which is where breathing problems occur. Also, we can shrink down the turbinates. These are fleshy cushions that sit on each side of the nose, and they can either be shrunk down or pushed out the way, and that can also improve the airway further. And this is really done to improve a patient's breathing. Sometimes it can improve patients' snoring as well, although that's a more complicated problem altogether. Who's an ideal candidate for functional rhinoplasty is really somebody who's having breathing difficulties. Now, often we see patients with both breathing problems and also concern about the shape, but we can just do functional rhinoplasty as well, and that's sometimes all the patient wants to do. Of course, a septoplasty alone may be sufficient, but in many cases, the rhinoplasty aspect can improve things further by adding grafts or helping to straighten the septum, particularly if it's a very high septal deviation, and then a rhinoplasty is required. How do we do a functional rhinoplasty or a functional septorhinoplasty often? It can be done either through what's called a closed approach, where little cuts are made internally in the nose and no external incisions are made. But often we need to do an open approach where a little cut is just made underneath the bit of the nostril here in the columella with all the other cuts internally, and that allows us to lift the skin to deal with all the underlying structures. And that's particularly relevant if we're having to put grafts in, such as spreader grafts or batten grafts, which is a much easier thing to do in an open type procedure. But nonetheless, we can do these things via a closed approach as well. So lots of different options. Recovery time will vary amongst patients, but in the majority of patients, it's about 2 weeks or so. The first week, there is a plaster on the nose and some stitches which are normally dissolvable. And if it's a closed approach, no stitches at all, although there'll be internal stitches again, which are all dissolvable. The plaster is normally removed in about a week. And then most people have a little bit of swelling or bruising, which disappears very quickly thereafter.